Welcome to Healthcare Management Part 2. This is HSC 4630, Understanding U.S. Healthcare. The presentation objectives are: review the key skills of healthcare managers, explain how managers work with physicians, explain how managers work with nurses, and discuss interprofessionalism and the role of the healthcare manager on the interprofessional team. Key management skills. Strategic planning is a key management skill. Healthcare managers evaluate the internal and external environments in order to develop plans for the future. The key to strategic planning is developing competitive advantage. The more effectively the organization can deliver services or products to customers, the more profitable and stable the organization can become. Competitive advantage reflects the ability to deliver services or products to customers more effectively and efficiently than their competitors. Competitive advantage reflects differentiation from the other competitors in the ability to deliver products and services to customers. One way to identify internal and external environments is to use a SWOT analysis. The SWOT analysis shown on this slide evaluates the strengths, weaknesses, opportunities, and threats involved with the organization and their external environment. On the internal axis, healthcare managers will evaluate the strengths, that is, those things that are helpful for the organization. It will also look at the weaknesses, things that are harmful to the organization, from the perspective of internal or inside the organization. When looking at the external organization, helpful things are called opportunities, and those that are harmful are threats. A good health services manager will be able to identify the strengths, weaknesses, opportunities, and threats to develop a strong strategic plan. Project management is the act of coordinating the temporary efforts of teams under set budgets and tight deadlines. The project management discipline first emerged from large engineering ventures, such as building a Hoover Dam, but today it's used in health services management. Project management principles can be applied to any project from improving healthcare delivery to building new hospital wings and IT projects. The idea of a project manager is to manage the entire project from inception all the way to project close. It requires quite a bit of technical skill to define the scope of the project and manage both the budget and the quality of the project. Many health services managers begin their careers in project management roles. It is a great place to start a management career. Limits are placed on almost any project, and project managers are responsible for managing the conflict between all the priorities, all the constraints. This Venn diagram is the triple constraint model. When one of the three constraints changes, trade-offs among the other two must be made. As you can see from this Venn diagram, typical constraints include scope, time, and cost. That is, the client will always want a bigger scope than you've agreed upon. The client will want it faster than you can deliver it and cheaper than can be possibly created. So, the idea is to manage all of those constraints. Now, you can, in fact, have an all-inclusive and very fast project, but it's going to be very expensive. You can have an all-inclusive and cheap alternative, but it's going to be quite slow. And you can have a cheap and fast project, but it's going to have limited function, won't be able to do very much. In the middle there, in the overlapping Venn diagram circles, are rare. The rare project that is all-inclusive, fast, and cheap. One of the main tasks of a project manager is called the work breakdown structure. every project has many tasks associated with it. This example is building a cottage. And of course, you would have to do site preparation, buy the resources, construct the cottage, clean the cottage and the area around it, and hand over the deliverable to the client. But each of those have detailed tasks under them. The work breakdown structure allows a project manager to analyze all of the tasks and associated deliverables for every project they engage in. It often takes collaboration with the team to understand what the various tasks and components are and to understand how the deliverables can be grouped together in discrete groups of tasks. A project manager then holds the individuals accountable for delivering those products, site preparation, buying resources, construction, and so on at a time agreed upon. Another important concept in project management is known as the critical path. Inevitably, the client will ask, so when is the project going to be done? You won't know that, of course, until you work collaboratively with the team to understand how long each task will take. Each task then has an associated duration, and if tasks are first required to do another task, then those tasks need to be lined up. The critical path is the number of tasks that have to be done in order and the length of each of those tasks in duration, added all the way up. In this example, the critical path is 14 days. That is, the critical path is activity A plus activity B plus activity C plus activity D, then the finish. That is, activity A has to be done before activity B, and activity B has to be done before activity C, and so on. Now, activity E and F can actually be done at any time, which means those tasks can be done in parallel. Activity E, which takes 4 days, and activity F, which takes 4 days, have a little bit of slack as to when they start and finish. Now, the critical path then equals 14 days. So the question to the client about when it's going to be done, 14 days. Project management also has an important tool called a Gantt chart. This chart summarizes all the information collected from the project team regarding the tasks and the durations, and it adds due dates and dependencies. Due dates are when each task will be completed. The durations, then, are calculated from when they start to when they end. And then dependencies are the links between the tasks that need to be completed before another one can begin. In this chart, those dependencies are reflected by the red arrows. Milestones are also added to this chart in the form of red diamonds, allowing the project manager at those various points to check on the progress of the project completion. The Gantt chart is a famous chart really depicting on when each of the tasks will be done. The project manager can track the progress of the project using the Gantt chart. Healthcare managers are also responsible for performance evaluation. That is, health services managers need to measure the success of the organization. Typically, there are 3 different concepts that health services managers track: efficiency, effectiveness, and productivity. Efficiency means doing things right. That is, the biggest bang for the buck. Lowering the costs or increasing the outputs relative to those costs. Effectiveness is doing things right. Setting an objective and fully meeting that objective is effectiveness. Productivity, then, the relationship between efficiency and effectiveness in its input and output. How much can you create for the given amount of resources? Here are some examples of performance evaluation for effectiveness These metrics are common in healthcare management to evaluate the performance of the healthcare organization. Of course, mortality rates is one of the most common. For example, the 30-day hospital mortality rate. That can be defined as the percentage of patients who die within 30 days of being admitted to the hospital, including deaths occurring during the stay and those after discharge, but within 30 days. Morbidity, or illness, is also an important concept to measure. One way to do that is through the Charlson Comorbidity Index. This is a weighted index that predicts the risk of death within 1 year of hospitalization for patients with specific comorbid conditions. Another common effectiveness measure is readmission rates. For example, one called 30-day hospital-wide all-cause readmission rates. What this does is measure the number of readmissions, that is, someone who comes back to the hospital after being discharged, within 30-day period. All of these measures calculate how well the healthcare organization is performing in terms of effectiveness. Is it doing what it set out to do? The following are efficiency metrics used in healthcare management. Cost efficiency, of course, is a very important concept, and one way to measure it is expenses per inpatient day. That is, the total annual cost for the healthcare organization divided by the number of patient days per year. The goal often is to reduce the total expenses per inpatient day. Another is resource efficiency. For example, clinic appointment utilization is an important efficiency measure. You'd want to fill up all your appointment slots with patients. It's measured or defined as percentage of available appointment slots that are utilized by patients. Higher utilization rates suggest efficient scheduling and optimal use of clinic capacity. A related measure is time efficiency, operating room turnaround time. That is, the time elapsed between the prior patient exiting the operating room and the next patient entering the operating room. You want the time to be used as efficiently as possible. Productivity metrics are also important for healthcare managers to evaluate performance. One concept is labor productivity. It can be measured through outpatient visits per provider. That's defined as the number of patient visits divided by the number of clinicians for a specific period of time. That is, how many patients can a provider see in one day or one period. Non-labor productivity might include supply cost per unit of services, the total expense for services divided by the number of units of that services, looking at the expenses related for every service provided. Managers are also responsible for giving feedback on performance at the organizational level and at the individual level. The graphic shown on this slide is a performance feedback loop. The idea that you set a goal and then have actions in the task environment to accomplish that goal. Then you have performance on that goal. And then you evaluate in the performance feedback whether the performance equals the goal. In cases when the goal is not achieved, then you create new actions to try to improve the performance to meet those goals. Management is the act of setting the goals, tracking the performance, and evaluating the accomplishment of the goal. Working with physicians. There are many types of physician specialties, from preventive medicine to specialty medicine. This chart shows the average annual compensation by specialty for physicians such as pediatrics, all the way to plastic surgery. There are types of primary care physicians. Many doctors are trained in internal medicine and go on to become specialists, although many stay as primary care physicians. Pediatricians treat children. Family medicine treats all ages, often in small towns or rural locations. Obstetrics and gynecology address women's care, and internal medicine and pediatric doctors, like its name implies, addresses both adults and children. That's a relatively new primary care specialty, with additional training in pediatrics beyond that of what family medicine doctors get. In the past, most physicians worked for themselves. In the community, had a few practicing physicians in each group. Today, many more are employed by healthcare organizations. They like the fact that they don't have to run their own small business, and it creates a stable income when you work for these larger organizations, such as hospitals and large physician practices. In addition, physicians tend to be more trusting of the organization, identify with it, and have better job satisfaction. This is a change from the past, where doctors were solo practitioners in these small towns. Today, these are sophisticated businesses. In large healthcare organizations, more and more executives are sharing the duties between non-clinical and physician executives. The job is so big that it's often helpful for managers and clinical professionals to join in managing the organization. It provides credibility on the clinical side and expertise on the management side. This relationship occurs not only in the suites of executives at the top of the organization, but also throughout in the mid-tiers and lower, where organizations such as a department may be shared in its leadership by managers and clinicians. Here are the details of the roles in the dyad leadership model. Who's in charge? Both the physician leader and the administrative leader. Physicians are responsible for the clinical strategy. They deal with doctors and quality of care, clinical innovations and initiatives, make sure that in compliance with clinical pathways and management are followed. The administrative leader is responsible for business strategy. Managers plan growth and operations, supply chain management, deal with revenue and operation expense management, do capital planning and staffing and hiring, performance reporting, and of course, work on the support systems and services involved with running healthcare services. Working with nurses. There are many types of nurses. At the lower end of the education requirement are something called Certified Nursing Assistants, or CNAs. They often do between 4 and 12 weeks of education preparation, and they have to take a state license. They're typically paid less than other types of nurses, but often as an entry-level type of nurse as they earn more credentials going forward. The LPN, or Licensed Practical Nurse, or Licensed Vocational Nurse, LVN, is a 1-year program, and they have an exam they have to take to earn licensure. They typically make a little bit more than CNAs, although not as much as registered nurses. Registered nurses can get an associate's degree or also be prepared as a Bachelor of Science, 4-year degree program that qualifies them for certain jobs that the associate's degree RNs would not be able to get. The income is relatively high for registered nurses and can get higher depending on the experience. Many RNs go back to school to attain an advanced practice registered nurse degree, such as a Master of Science. Some also earn a Doctor of Nursing Practice, or DNP, which is similar to a doctorate for medicine, except they are experts in nursing care. These types of nurses typically make 6 figures as they are experts in their fields. Nurses play a big part in running hospitals and other healthcare organizations. Managers work with nurses through nurse shared governance. These coordinating councils and groups of leaders, of nurses, get together and decide policy and make recommendations to the senior leadership of healthcare organizations about nursing practice. Managers enable and empower nurses to make decisions for how they practice, to give them autonomy over their profession, and to improve patient care. Certain committees are formed, such as Quality and Safety Council, Patient Care Leadership Council, department or profession councils, and practice and professional development councils. Each of these committees is coordinated by something called a coordinating council, who then makes solid recommendations to management and coordinates amongst all of the committees. Interprofessionalism. Interprofessional teams. Interprofessionalism is what happens when individuals from multiple health disciplines collaborate to deliver care. Begun, White, and Mosser advocate that healthcare managers actually contribute to the interprofessional team in meaningful ways. However, not everyone sees it that way. Today's healthcare organizations employ hundreds of thousands of managers to support complex clinical service enterprises. As you can see, the growth in administrators far outpaces that of physicians over the past 50 years. But as you can see, the growth in spending is related to the number of administrators. There is a bit of a chicken and egg issue. Do we have more administrators to deal with the large costs of healthcare? Or are the costs of healthcare attributed to administrators? Either way, this frustrates some physicians who see the growth in administration as a problem with healthcare today. So wait, are healthcare managers the bad guys of the healthcare business? According to the research I did with Mascar and Greenberg, they are. Are managers to blame for the difficulties experienced by clinicians who bristle at policies that attempt to control costs, all while increasing both revenue and the quality of care? Maybe. Maybe not. But the frustration is there for clinicians. And healthcare managers who work on the interprofessional team need to be aware of the perceptions that clinicians have of healthcare managers. Part of the challenge for healthcare managers on the interprofessional team is the fact that healthcare managers are not required to get licenses. The profession lacks the exclusivity afforded to those clinicians who earn practice licenses. Medicine, nursing, and many allied health professions all have to get licenses. Without that license, clinicians may view health administrators as quasi-professionals. And in a way, without the licensure requirement, health administrators can be subordinate to the clinical professions in the social and political structure of the healthcare organization. This is a challenge for the health administrator in their participation on the interprofessional team. And so what is a healthcare manager to do? Hold the clipboard? The contribution of the healthcare manager to the interprofessional team can be underappreciated. But there is a role for us to play. Health administrators can champion organization-wide culture of interprofessional practice. In some ways, the perceptions of healthcare managers are unfounded. The healthcare manager has a role on the interprofessional team, and one that matches the values of many clinicians. Healthcare managers are presumed to be the business experts on the multidisciplinary team, but we have special motivations. We want to help patients. We want to empower clinicians. We're interested in building community ties and serving society. So certainly, our job on the interprofessional team is to build and sustain trusted work relationships with clinicians so that we can be effective as collaborators on interprofessional care teams. Managers have a role on the interprofessional team. Managers coordinate the actions of support staff who assist clinical professionals in delivering healthcare services to patients. We allocate resources, including money for clinician training or investments in technology and equipment. We support clinical performance through human resources function, we evaluate teams and individuals, and we reward achievement. Healthcare managers also hold the interprofessional teams accountable for outcomes of quality improvement projects. Healthcare managers encourage healthy conflict and resolve power struggles among clinicians, and we role model interprofessional practice such as assuring a variety of professionals are represented on various committees. In conclusion, healthcare managers possess unique skills. Managers implement programs. We plan, we assess, we evaluate. Healthcare managers work with physicians and work with nurses. And managers contribute to the interprofessional team.